All right. So I'm going to start off by introducing myself to my client. Hi, my name is Jordan Reynolds. I'm going to be your student nurse today. I will then perform hand hygiene. I would ask my patient for their name and their date of birth.
Jonathan Hall, November 13th, 2000.
I would check their wristband for confirmation. I would then explain the procedure. Today what I'm going to be doing is performing a head-to-toe assessment. So let's get started. Can you tell me what day of the week it is?
It is Monday,
What month?
March.
Yeah. I thought you might not remember the first. So can you raise your left arm? Raise your right arm. That shows that the client is alert-oriented and can follow commands. Next time we'll be performing PERLA, which stands for Pupils Are Equal, Round, Reactive to Light, and Accommodation. So I'm going to start off by checking the size of my client's pupils. 5 millimeters. Isn't that right? Yeah. I will then turn on my pen light and check to see that both eyes constrict. And then the last part of PERLA, I would have the client stare off at a distance for 30 seconds and then bring my pen light or another object in at 14 inches and then bring it to the nose and the eyes should cross. But to save time for the video, I'm just going to bring the pen light in at 14 inches and the eyes cross. Next what I'll be doing is checking for the breath sounds in all lung fields. So I would clean my stethoscope before I did this, but I don't have any alcohol wipes. So I'm just going to cover the shirt.
All right.
And inhale. Compare. It's all right. I'll then ask the patient, do you mind leaning up, sitting up? And that shows that he has upper body mobility. Breathe in. Okay. While I was assessing my patient's breathing, I didn't notice any accessory muscles to breathe or nasal flaring. I would then ask my patient if you're experiencing any cough.
Nope.
Shortness of breath.
Nope.
I would then check the respiratory rate, but to save for time, I'm just going to explain what I would do. So I would palpate the radial pulse, so which that would be the thumb side of the wrist. I would count it for a minute and then remember that number and then secretly count his respirations for a minute and chart that. I will now check my patient's mouth and nail bed for color, and I don't notice any blue discoloration, which would indicate that he is cold or could be low oxygen status. And so the nails bed appears to be pink, and since I'm already down here, I can check for capillary refill. And they return back to normal in less than 3 seconds, which is normal. To save time for this video, I'm also going to check for apical pulse, which will be the location. So I'll be listening to the heart. The location would be the 5th intercostal space, left mid-clavicular line. I would listen to that for a minute and document. And then also for blood pressure, I would palpate the brachial artery, put on a cuff, pump it up until I couldn't feel it, and then add 30 millimeters of mercury to that, and then slowly release the air and document my findings. Next, I'll be checking the bowel sounds, so I will ask the patient if he doesn't mind if I raise his shirt up. You know, I will. Well, you probably don't have to raise it up. It'll be okay. I will divide the abdomen up into 4 quadrants, and what I'll be looking for, listening to, is gurgling. It's all right. You still can't hear through the shirt though? I don't notice a catheter. I would then ask the patient to describe his urine frequency, color, and clarity, if you don't mind.
Urine's good, clear, normal, not peeing a lot, not peeing too little.
Okay.
Yeah.
I would then ask the patient his last bowel movement and the color.
After lunch, brown.
Okay. Any discharge? Use of a diaper. Are you on a specific type of diet?
Low carb.
When did you start that diet?
Back in my Christmas break.
Now I'll be checking the extremities so I can check for hand and ankle strength. So I would have, for the hands, I would have the patient squeeze my fingers. Okay. Now I'll be checking for ankle strength, so he'll be moving his ankle against my hand, so resistance. While I'm down here at the feet, I don't notice any swelling or edema, which is like fluid buildup. And also I can check the legs, well, his pants leg, and his arms. And I don't, his arms appear to be warm, dry, and pink, which is appropriate for race, and intact. And I can check for skin turgor, which is another way to check hydration status. So I'll be pinching up near the clavicle. And I would also ask the patient if he's experiencing any pain on a scale of 0 to 10.
No pain, 0 to 10.
And any allergies. That concludes my head to toe assessment.